Today, Luann is scheduled to take care of a patient that has MRSA. There's contact precautions on the door, so she has to put on the appropriate PPE. The first thing, Luann has already washed her hands. She needs to put on a gown. The gown is a single-use gown. She's just taking care to unfold it. She'll put each arm in and tie the strings in the back.
And this is outside the room, correct?
Correct. This is outside the room. There should usually be a cart or something that hangs over the door that has all of the PPE in it that you need in order to go into the room. Also, Luann would have made sure that everything that she needs, maybe she needed to take a set of vital signs, that all that equipment is already inside the room, because once she has all of her PPE on, she cannot come back outside of the room to grab any equipment that she needs unless she undoes all of her PPE and puts back on her PPE.
Okay.
So after her gown, she's going to put on a mask. And there's a little metal strip on the top that fits over the bridge of her nose. She's going to put behind her ears, and she's going to pull that face mask down so it covers her whole face. The next thing she's going to put on is her eyewear, or goggles. And because Luann has glasses, she still does need to put on goggles because it covers more area on her face to protect her. The last thing she's going to put on is gloves. So Luann has put on all of her PPE outside of the patient or resident room. Good, and she's just tucking under the cuffs of her gown as to not expose any skin. Good. So now Luann's ready to go into the resident or patient room.
Alrighty. Knock, knock, knock.
Okay, so Luann has been in the room. She's done everything that she needs to do in the room. Now she's ready to take off her PPE. She will take off all of her PPE within the room before she comes out of the room. The first thing she's going to take off is the most contaminated, which is her gloves. She's going to grab it by the palm and pull it over the top, put it in her other hand so that the other glove covers the first glove, and throw it into the garbage. The next thing Luann is going to do is take off her eyewear. Eyewear can be used by the same person taking care of that patient for the whole shift. She can put that off to the side, knowing that she can reuse that piece of PPE within that shift. The next thing she's going to take off is her gown. She's going to untie the back and untie the waist. The most contaminated part of the gown is the front of the gown. So she's going to go underneath her shoulders and kind of pull it over and go underneath as to not contaminate her hands. She's going to kind of ball that up and put that off to the side. The last thing to take off is the mask. So she's going to just take behind her ears and pull that off and put it into the garbage. The last thing Luann should do before she leaves is wash her hands. If they're within 3 feet of a resident, you can be in the bathroom and also wash your hands if you're within 3 feet, and then you can leave the room. So if they don't have gel, you certainly could go into the bathroom. If it's 3 feet away from the patient or resident, wash your hands and come out of the room. Now Luann is ready to come out of the room.